Good morning, everybody, and welcome to this special meeting of the Health and Wellbeing Board. I am Councillor Alan McCrow, and I'm Chair of the Health and Wellbeing Board. Before we start, I would like to explain, for the benefit of members of the public who may be watching, that today's meeting is being held in a hybrid format. We have a quorum of board meetings in the council chamber. I'm joined by councillors Janine Lewis, David Marsh, Joe Stewart, and also by Paul Coe, April Pebbody, and Sarah Webster. Other board members and substitutes attending remotely are
Fiona Warby.
I'm sorry?
Just Fiona Warby.
Fiona Warby, I beg your pardon. Also like to welcome Rob Bowen from the Bob ICB, that's the the Buckinghamshire, Oxfordshire and Berkshire West Integrated Care Board. Thank you. The meeting is being live streamed via YouTube, so members of the public are able to follow proceedings. Gordon Oliver is the clerk for the meeting and Jack Karimi is the Zoom host. Please note that only board members who are present in the chamber can take part in any voting. However, prior to any formal vote, there will be an indicative vote amongst all board members, including those attending remotely, to give an indication to those in the room as to the views of the total membership. I will now ask the clerk if we have any apologies, please.
Yes, Chairman, we've received apologies from the following: from Councillor Heather Codling, Superintendent Zahid Aziz, Matthew Hensby, Jessica Jundu-Evans, Stephen Leonard, Dr. Janet Lippett, Gail Muirhead, Sean Murphy and Dr. Heike Veltman.
Thank you. Do we have any declarations of interest, please? We move on to item 3, which is the membership of the Health and Wellbeing Board. This is membership is on an organisational basis. I have a standing agenda item to note any changes in personnel. So the changes since the last meeting include councillors Alan McCrow, that's myself, Heather Codling, Lee Dillon, Janine Lewis, David Marsh and Joe Stewart were appointed to the board at the annual meeting of West Berkshire Council on the 25th of May. Stephen Leonard has been nominated as the representative of the Royal Berkshire Fire and Rescue Service. Also, I've been informed that Superintendent Zahid Aziz will be retiring in July before the next meeting, so on behalf of the board, I would like to thank him for his contribution. This is just an item to be noted, so we don't need to vote. Thank you. I'll move on now to item 4, which is the Bob ICB joint forward plan. And I've been asked to agree the formal response to the joint forward plan, which is due to be submitted at the end of June. I would like to invite Rob Bowen to present the joint forward plan, please.
Thank you, Chairman. Just in terms of brief introduction, I'm conscious that people will have had papers and had an opportunity to read papers, but I thought it might be worth just stepping back a little bit and remind people of what the purpose of the joint forward plan is, and a little bit about the process about how we've developed the joint forward plan before we get into a discussion about alignment with the Berkshire West Joint Health and Wellbeing Strategy. So I'll just do a very short introduction into some of that to maybe inform some of the discussion that we might want to have. So the integrated care system formally came together in July last year, and one of the first activities that was required across the whole of the integrated care system, which, as Alan has introduced, is across Buckinghamshire, Oxfordshire and Berkshire West, so a big geography with lots of organisations represented. One of the early activities was to agree a common direction of travel for how we, as a group of organisations, wanted to provide care and support to the people and communities that we serve. So there was work that was done across all of those different organisations, bringing together particularly the 5 different local authorities, but also bringing together the NHS organisations, voluntary and charity sector, some of our academic organisations as well, to understand what some of our common ambitions were for the people and communities that we serve, and building those together to identify a common set of strategic priorities. Though we ran a period of engagement through December and January on those strategic priorities, which were then converted into the integrated care strategy for Buckinghamshire, Oxfordshire and Berkshire West. That integrated care strategy was published right at the beginning of March this year, and set out 5 strategic themes, which have got a number of objectives that sit under each of them. And the 5 strategic themes are around promoting and protecting health. So that's really about trying to keep people well for as long as possible. Then we had strategic themes around start well, live well and age well. Again, about trying to keep people well, prevent ill health, support independent living as much as possible. And the 5th strategic theme was around ensuring high quality services and improving access to those services across the range of different services that we provide across the partnership. That strategy was agreed by a standing committee, which is called the Integrated Care Partnership. Each one of the Berkshire West local authorities has a place on the membership of that partnership, and so that was voted through and agreed as the strategic direction for the whole of the Berkshire, Oxfordshire and Berkshire West system. That set out a really clear ambition for what we wanted to achieve for our people and communities, but it didn't say very much about how we were going to deliver against those ambitions. So the joint forward plan is the NHS's description of how we will deliver against the ambition that's set out in the integrated care strategy. So what we would expect as we're looking at that is to see considerably more detail about how we would be describing the delivery plans for a number of different clinical services and kind of how some of the partnerships we would expect to support delivery might develop. So when we start to look at the joint forward plan, firstly, we need to be clear that it is a plan for NHS services. It does describe how those NHS services will link closely with our partner organisations, so we'll link really closely with the work that's being undertaken by the different local authorities that we interact with. Really importantly in Berkshire West, kind of linking in with the place structures that Sarah leads and others around the room are involved with. So it kind of, there is that direct link to the ambition that we've got locally, and I'll say a bit more about that as we go through. The joint forward plan, I think we can really look at in 2 parts. So there is one part that identifies a number of big strategic challenges that we have across the system. Those challenges have been identified as things that we know that will require a system-wide approach to how we tackle them. So there are challenges there, particularly around inequalities, thinking about how we do more in the community to keep people healthy and well close to where they live and work. Some work there around access and waiting times and how people experience the services that we provide. And lastly, thinking about how in the long term we are making the services that we provide more sustainable, particularly around finance and the different workforce challenges that we know that we face. The second part of the joint forward plan is is really around the detailed delivery plans. And there's lots and lots of detail when you get into the full document. So there's about 150 pages that sets out in lots of detail what our ambition is for specific clinical services. And the way that we've described those services links really closely with the same structure that we've used for the integrated care strategy. So we've got some services around protecting and promoting health, start well, live well, age well, and then quality and access, high quality access to our services. So that's sort of the purpose of the joint forward plan. I'm really happy to take questions as we go through that. Just really quickly in terms of process that we've been through to develop that. This has been a continuous process through the development of the strategy, where we've been really clear that we want to build on the strategies that already exist with our partner organizations. So the first place that we started was to have a really good understanding of the local health and wellbeing strategies across our different areas, and the strategies that exist for our local NHS organizations and other organizations where that's relevant. We then built those up through a really collaborative approach with our partners to identify the common priorities. We had that period of public engagement. And then as we flipped that through into the delivery planning for the NHS services, again, we've continued to do that in as collaborative way as we can. So really trying to listen to and understand what are some of the aspirations that our partners might have and how we can work in partnership with those in terms of delivery. We published a draft at the end of March, and I've really had a quite intensive period of engagement through April and May of trying to understand how people might like to see changes to what that initial draft was, and we've tried to take some of those changes into account as we've been going through. So that's, again, happy to take questions on the process if people are interested in that. Thirdly, in terms of alignment, which is really the big question for today, we have, as I said, from the beginning of this process, really tried to build on what the local health and wellbeing intentions were. We had to take account of all three of the local health and wellbeing strategies that have been published across the Berkshire, Oxfordshire and Berkshire West areas. And I think you will see as we sort of work through the different documents that there is a close alignment in the way that we have set out some of our intentions. So for the Berkshire West health and wellbeing strategy, there are a number of different priorities, and if I might just run through those and make the connection. So the first is around reducing differences in health between the different groups of people. We have taken a really strong ambition to reduce inequalities across all of our different services that we provide. So as you look through those detailed service delivery plans, you will see that tackling inequalities is something that is common across all of those service delivery plans, in as well as recognizing it as one of the four main challenges that we want to address across the system. We expect that we will be working really closely in partnership particularly with local authorities to address those inequalities. And lots of that will be very, very locally developed in West Berkshire. That will be through Sarah's leadership, working with partners there. The next priority for the West Berkshire Health and Wellbeing Strategy is around supporting individuals at high risk of bad health outcomes. So again, this is recognizing that our populations are different, and there are some populations who are at higher risk, and recognizing that we need to think differently about how we are providing services and support to those people. And again, we've got a number of different activities that have been identified through those service delivery plans. So, for example, how we think about people with long-term conditions. We've got specific programs of work that will support people with long-term conditions to help them stay healthy and well, to manage their own conditions as best as they can, and try to reduce the reliance on our acute hospitals to manage those conditions. So within those service delivery plans, we've got some really bold ambitions about how we will continue to support people at higher risk. The next priority is around helping families and children in early years. We have identified through the Start Well priority a number of different services specifically trying to support families and children and young people through that early years development, but also particularly thinking about children who have challenges around mental ill health and how we can support those children and families particularly. And then the last two priorities around mental health, so both for children and young people and also for adults, we have split out the description of our ambition for mental health services so that we can be really clear about the ambition that we've got both for children and young people and for adults. The intention that we've got there is absolutely to ensure good access and to try and promote better access where we know that we have some challenges around long waits, but also to think about the support that we can provide, particularly around prevention and trying to think about how we take a more preventative approach to people who are at risk of suffering from mental ill health. So I hope colleagues will see that there is a close alignment in the ambitions that we've taken as we've been thinking about the joint forward plan. I recognise that there is a proposed statement that does acknowledge this, but really happy to take questions on either what it's for, how we've developed, or what that alignment is. But I think over to Paul for the time being.
Thank you. Does anybody have any questions for Rob before I move on to asking Paul to present our response? Councillor Lewis.
Thank you very much, Mr. Bowen, for the report so far. I'm new to this and my questions will probably be answered fairly easily because I haven't got the backstory. But you're saying this is to provide support to carers and parents, and this is also to help support young people, especially with mental health issues. And I know there's still a massive range of things that you are covering. So when you were putting this report together, did you include young people or the carers or parents? At any point did you go to them to ask what they need, or has this been put together by professionals?
So really helpful question, thank you. We have tried to include a broad representation of people in the development of both the integrated care strategy and the joint forward plan. We have, through the development of the joint forward plan, run a series of focus groups, and those focus groups have included a number of different voluntary and community sector organisations, which has included, I need to go back and look up the list exactly, and I'm happy to share that with you. We've got a report on what that engagement has been, but actually there has been a considerable emphasis through those focus groups on the Start Well element of this. So there are voluntary and charity sector inputs which will have that representation. What we haven't done, and we are aiming to do through a number of different communication channels, is that direct engagement with children and young people. There is an ambition that we are doing more as we develop this. So one of the things that I didn't say about the joint forward plan is that it is an annual, it will now be an annual plan that we develop. This is the first time that we've done it. So we've all been slightly feeling our way in terms of process to make sure that the document is as high quality as we can get. There are things that we need to do better as we go forward for next year's publication. And I think one of the areas would be around engagement. And we know that we've got a gap around children and young people. So we'd welcome advice and support as to how we do that as well as we can.
Any other questions? Thank you. I then call on Paul Coe, who's this council's interim director of executive director of people, to present our response. Thank you.
Thank you, Chair. Yes, and just so board members will have in front of them a short paper by me and a proposed draft response, just to say that we've reached that position by inviting board members to comment on what they are seeing in the joint forward plan, and also a targeted exercise with officers of the council to draft that form of words. Fundamentally, what I'm suggesting that the board responds is positively, to note the progress, to note the good progress, recognition, of course, that this is a really big piece of work. It shouldn't be underestimated. And that's complicated further for the West Berkshire and Berkshire West space by the fact that we have a particularly complex local system, and recognising that that's been considered sensitively through this process. Certainly, I think we should be recognising as Rob's just set out, the real commitment to engagement from a wide range of stakeholders, and also picking up on Councillor Lewis's point that this is a stage in a longer journey, to use that often hated phrase. We are to the point where we are, and more work will be done, both on further iterations of the plan, but also on the building of relationships and the engagement with groups that have not yet been directly heard from. I won't go through the text in close detail, but just I would want to make a couple of particular points. So we, and those putting this proposed response together, recognise this is as strong on the inequalities piece, really important to the council, to the health and wellbeing strategy, and to the wider system, that we address those inequalities that we see. And also recognition that there is really good balanced consideration of the issues across the life course, children, young people, all the way through to the older age. So those are positives. We also took it as an opportunity to make some points, as you would expect, to recognise that subsidiarity is an important principle in the operation of Bob. And that we need to understand where decisions are being made, and that they are taken in the right place for the right reasons, and also wanted to make the point that this board remains really critical. In terms of the population of West Berkshire, this board needs to be a really key player in the decision-making process. Also, I guess the second point to labour somewhat, and Rob's spoken a good amount on prevention. I think we want to make the point that is absolutely core to our aspirations and to our thinking, and to recognise that it's hard to do, but really impactful where it is done. So recognising that it's in the plan, but nonetheless doing will be tough, and yet critically important that element is delivered and delivered fully. And I will stop there. But so fundamentally, in summary, we like it. Let's carry on.
Thank you. Do have any members have any questions or points to make on our draft response? I understand John Ashton online would like to make a point.
Hi, thanks very much. I mean, I'm Interim Director of Public Health, and I welcome the opportunity to comment on this. We discussed this last week with the same presentation at the Reading Board of Health and Wellbeing, and the response was very similar to what we've just heard, in as much as it was welcomed and supported, and recognising that this is really a stage on a journey, and there'll be a review annually. And I agree with Paul's remarks that he's just made. I think the important thing that I would just say is that integrated, concerted local public health action at the place level of neighbourhoods and communities has to be at the heart of this if it's to deliver. And the danger with the present structural arrangements is that the default position will still be towards high-level NHS-based activity. And that has to be borne in mind all the time here when it comes to trying to implement this. The important role of the Board of Health and Wellbeing and of the Director of Public Health within the Board of Health and Wellbeing is something which I would underline, because this is where public health needs to be integrated into the activities, not just across the council, but linking across to the NHS and outside into the community with the voluntary sector and community groups. And at the moment, I think we have problems about the strength of that capacity in West Berkshire and indeed in Berkshire West itself. I think that my understanding really is that Berkshire West doesn't exist as an entity, and you know, the only sense it exists is in terms of where there's functions that are joint between the different councils. So I think the focus needs to be on the contribution of each council and each council's Board of Health and Wellbeing, and the strategy needs to be joined at the hip with the boards of health and wellbeing work. I think that's what I would really say.
Thank you. Councillor Stewart.
You knew before I put my hand up, you could tell I was going to speak. I think for me, this is a positive start. And I think the one thing that I am encouraged by is the honesty in some of in parts of this paper. One of the things, some previous backgrounds, data. How do you prove that you've delivered what you said you were going to deliver, and actually the challenges of the data to be able to do that. It's concerning to see that we're not in a good place, but it's good to see that we recognise that, and hopefully we will do something about it. So data challenges in particular. Financial challenges. So I think if I recall in this paper, much like I guess many organisations, you can't always see that far ahead about what finances are going to be available, and in particular, some things are ring fenced, and other things can't be touched for perhaps what you want to deliver. So I recognise that, and that's why I'm saying about this as a good start, because we could begin this, and the review in a year's time, where we know what that next financial position will be, could mean that some things have to change. And then I think the other thing that is still perhaps one of our, it could even be the biggest challenge, is workforce. And we know this from our own local authority workforce challenges. And clearly there's much public conversation about similar in NHS with some of the actions and that have been taken recently in terms of striking. Money isn't always the answer, of course, to a satisfied workforce. And I think trying to find the ways to just ratchet that up a notch so that people want to stay in the NHS. I can absolutely understand why people are still very tired from the pandemic situation that they've been through, and trying to find the way to bring that forward and actually improve everything for them, I think is probably, as I say, that's the biggest challenge. You can have all the money in the world, but if you don't want people to work for you, then the things are not going to get delivered. But I'm very happy to support this, and I think the paper, the statement that's been put together is good. It references the key points that I think we need to. I think from perhaps from a board's perspective, our board's perspective, one of the things that I have felt a little remote from is what the current state of play is with our own health and wellbeing strategy and the plan and where we are with that. So I'd like to see, or suggest perhaps to the chairman, that moving forward, we actually start to have a section every time we meet where we're properly aligning and discussing that we are still aligned, and that we're not going off at tangents. Thank you.
Thank you. welcome, Gary Paulson.
Thanks very much, Chairman. Sorry, I was a few minutes late. I just really wanted to underpin how the voluntary and community sector has interacted with this process, really. And I think it's nearly 3 years ago now, we formed an alliance, a Bob Alliance, with my colleagues, my opposite numbers in Wokingham, in Reading, in Buckinghamshire and Oxfordshire, actually. And we've been working really actually quite hard in trying to form opinions and views and ensuring that our feelings and knowledge has been fed well into the process from the word go. And working with Sarah, meetings in Oxford last week about the workforce, incredibly productive meetings, and certainly a real opportunity to shape things. And I feel as if the voluntary community sector is being very well heard. And I feel, and it's certainly been true that all the bosses have been at these meetings. And I think that's been important. So we, from the voluntary community sector, and I think I can speak for my colleagues around the rest of Bob. I think we're content. We just want to make sure that the things that we've said are going to happen now. But yeah, I'm very pleased with at least the opportunities we've had for input.
Thank you. Any other points? Could I just make one observation, and that is, I think, on the kind of living well aspect, there's a fair amount in the plan about reducing tobacco consumption and excess drinking and so on. And of course, that is also a public health function. So I think we do need to make sure that they work in combination and not crossing over or duplicating. Thank you. So we have a paper before us, which I think we're fairly happy with, but I'd like to make sure, could we have an indicative vote, please, about whether we can approve this document going forward? All those in favour, please. And it's good. Sorry, could you tell us the result?
Yes. That was in favour.
Thank you. So in that case, could I have the real vote, please, from the members in the room? Those are, sorry? Oh, sorry, I need a proposer and a seconder. I beg your pardon. So Councillor Lewis is proposing. Councillor Stewart is seconding. Thank you. Those in favour, please. Thank you very much. Anybody against? I think it was unanimous, wasn't it? Yeah, thank you. Is there any other business? Okay, thank you very much. There being no other business, I'll close the meeting. Thank you very much.